Hey y'all, majority of this video is going to be a voiceover. I found that this was the easiest way to explain this video and avoid HIPAA violation and respect people's privacy. So I typically start my day at 5:30 p.m. This is where we start our day. Typically, we come in, put my stuff in the locker area, then we go out to the break room to have huddle. Obviously, I'm not going to show this out of respect for people's privacy, so I came in earlier to show you where we have huddle at. This is where we get our assignments for the day and we find out where the tech goes or where the nurses goes, how many people are in the ER, and how many people are on the ER and what's the census on the floors, and if we're going to be able to transport a lot and get a lot of beds. Once we give a report, we typically go to our designated area. We get a brief description of what the tech did or not from the previous tech, and we start our day. It's typically transports at the beginning of the shift. So occasionally we have to do some blood draws and cleaning rooms, and it's a whole lot of lists. I'm going to just show you little clips of me doing everything except for the blood draw. So as a tech, you will be asked to grab lab work a lot and drop it off or collect it. So we do CBCs, blood work through straight sticks, Foley's or catheters, and straight calves, and regular flu, COVID swabs, RSVs, plain stuff like that. So as a tech, your main job is going to be transporting. It was also going to be the pain in your butt. That typical day that I took this video, I had transported 29 patients, and majority of them went to the main tower, which is a quarter of a mile each trip. So the major part of your shift needs to be focused on stocking. This is a big concern. I know people like, okay, it's just stocking, but honestly, if you don't spend time on stocking, you make your life difficult. Or if the tech before you don't spend time stocking, it makes your life difficult, because majority of these stuff that we stock in the rooms and stock in the IV carts we use on these patients and these nurses use on these patients, and please and believe they get aggravated and then they will be calling you left and right, so then you will have to walk to get this stuff, then walk back to them, and then in between the patient might have pooped or pee. Or maybe if we have a trauma and your room and your area is not set up, or you didn't set up that bed for that trauma, they're barking orders about, I need a GE tube, I need what else they need, a chest tube, I need suction, I need blah 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 blah. It's a lot. So please, just because it's tedious, focus on stocking. I know that's not like a flashy thing to do as a tech, but it's so much smoother for, like, say you have a patient that comes in with a GI bleed. You know how many chucks you go through. So if you don't stock and the tech don't stock over you all that GI blood, oh my god, I cannot. I'm emphasizing in this video to stock. Oh, well, this is one of our tasks to do. Let me go back and get off my little rant. So after every patient, you will have to clean, and you clean with these wipes that they supply to you. And typically they tell you that the bleach wipe is for like C. diff patients, and the regular wipes are just to clean between each patient. But it's interchangeable for me personally. So you make sure you clean the cords and clean the beds, because EVS do not clean your room as a tech in ED, because we have too much volume of patient care. Like, they cannot break down, logically, we cannot break down a room in between each patient. So, EVS can come in here and clean it. So typically the tech is the one, sometimes a nurse, but let's be for real, not all the time. Really, mostly it's you. They will leave you to bed. The tech comes in and you wipe down the bed, wipe down the cords, and wipe down the handles, and sometimes you have like little brooms to like sweep up all the stuff, and you have to make sure you get the blood off of everything, even the floor, and you set up the bed. So we have to do this between each patient care. So some patients you will have who, obviously you saw me transport, go upstairs, and you just come back and you clean it. But then you have to think, say like 45% of your patients is getting admitted. The rest of that is going to be discharge patients. And with discharge patients, that's like flipping a room, multiple patients in a night. That's multiple sheets and beds you have to clean. And you wouldn't want someone coming in onto a dirty bed. And you don't know what the other person might have. So take pride in cleaning your rooms. Well, I do, personally. Everybody gets on me because I tuck my sheets. But, like, just think of it that way. If it's your mom or your dad and you come into a dirty room or a room that's not taken care of or not set up right, you're going to look at this place and like, oh, it's nasty. This bed is not clean. Then again, even though you clean this bed, they're going to ask you to clean the bed again. I'm not doing that. Just take pride. And honestly, it's my little breakaway from the nurses. I shut them doors, I clean my rooms, and I stay on it.
I'm in Charlie 11 right now.
This is our trauma rooms. This is how we set things up for gunshot victims. Typically, these will be already pre-organized and the leads will be on there. Blood pressure cuff will be on there, and the post-op will be on there for the trauma patient to come in. So typically around 3, I start stocking my rooms, pulling my trash, and like checking my IV cards. So on this particular day, it was a crazy day. Like I said, I took up so many beds that day. Then we had GSWs coming out, the woodwork. It was this day whipped me. But yeah, I have my little cart. I stock my rooms. I take my radio to the side so I can hear them, just in case they might need me or call me for transport. And that day we were kind of out of a lot of materials. But yeah, this is just a typical day of stocking and pulling my trash.
Silent treatment in your cup, baby, we don't need to talk. Sorry if I'm making this hard. Now I'm just wondering where we are. I don't wanna face the consequences, but baby, yeah, you know I hate second guessing. I'm just wondering where we are. Drifting into space, keep driving on the freeway. Baby, let me know what you are thinking. Baby, let me know what you are thinking.
Okay, so this is our book supply room. This is where we get everything. This is the cart I had. It's basically I had to unstock it after I finished, but the only problem is some stuff from procurement is up here where they didn't put their stuff back, so I had to put it back on there. But normally my cart would be empty. But yeah, the book supply room that I just stocked. These are the blood culture kits that we have to make. If I have time, I'll show you how we make one. But I don't know. Okay, so typically we don't do this in here. Well, I don't do this because normally our IV carts is like in 2 different stations. One is so we have to like stock it in one room and stock another. But luckily, one of my coworkers did a little whole cart, so I'm about to stock it in here in one room and sit down because I am tired. This day done whipped me. So this is going to be the end of the night for me. After I stock my carts, I line them up and I call it a day and then give a report to the tech that's coming after me. the reports basically is how many IV carts they have, what rooms are clean, what rooms need to go up, and that's it. This is kind of like a gist video. I'll give you kind of like an idea of what it is to be a tech. I will go into an in-depth version of it later on in a sit-down video, because of HIPPA violations, you don't really get to see a lot. I can't record a lot, and then out of respect for the people I work with, can't really show their faces. So yeah, here's the end of the night.
Overthinking out there.